In addition to older adults, flu vaccination is also very important in people with certain underlying health conditions. These conditions include asthma and other chronic respiratory diseases, heart disease, certain neurological conditions, diabetes and other metabolic conditions, and conditions that weaken the immune system, such as cancer. Chronic medical conditions are very common in adults. More than 30% of people in the US who are 50 to 64 years of age have at least one chronic medical condition that puts them at high risk for developing complications from severe flu. Importantly, flu can make health conditions like asthma, heart disease, and diabetes worsen, even if these conditions are well managed. For example, people with asthma have chronic inflammation in their airways, and flu infection can make asthma symptoms worsen or even trigger an asthma attack. The risk of having a heart attack is about 6 times higher within a week of lab-confirmed influenza or flu infection compared to other times. Additionally, about 30% of adult flu hospitalizations reported to the CDC have diabetes, compared to about 9% of the overall adult population. And this highlights that people living with diabetes can often develop severe influenza or flu. Flu vaccination can prevent complications associated with asthma, diabetes, heart disease, and other chronic medical conditions. For example, vaccination has been associated with a lower risk of cardiac events, such as heart attacks, in people with chronic heart disease. Vaccination is also associated with a reduction in the risk of hospitalizations from flu and diabetes events by nearly 80% in people living with diabetes. Yearly flu vaccination is recommended by the American Heart Association, the American Diabetes Association, and the American Lung Association.